Aaron, recently you shared some additional details on this partnership and what made it attractive to the board and to leadership, as well as some examples of the benefits to both the organization, our patients, and our community. Today, what we want to do is focus a little bit more on the partnership model itself. While I know you can't provide all the details on it, can you explain how this transformational partnership is different than a traditional merger, where a larger healthcare system would acquire a smaller organization?
Yes, so it's what I would call a transformational partnership and definitely a non-traditional partnership. Traditionally in healthcare, usually you have two health systems, usually a larger health system that would acquire a smaller health care system, and they basically take over ownership of that smaller health system. That changes the control of who makes decisions for that organization. It's called the change of control. And so then that changes the board, the governing board, and then there are subsequent decisions that are made at a place that wasn't where they weren't historically made. And so in this partnership, we're looking to create an arrangement with multiple partners that focuses first and foremost on enhancing clinical quality and safety. And we're thrilled to be able to potentially bring one of the top 10 health systems access to that top 10 health systems best clinical protocols, clinical trials, second opinions. We are just extraordinarily excited to really combine the legacy of quality and safety that South County Health has with a top 10 national health system. And so first and foremost, there's the quality enhancement. But that in and of itself doesn't require a change in control. The second thing we're going to do is really focus on digital modernization and creation of value. So we're calling it a health transformation organization. And really transformation, South County Health has multiple key strategic initiatives. One of them is access. And so this partnership really helps to create access not only to the traditionally excellent care that we provide to everyone in this community, but also additionally, as I mentioned earlier, world-class care through partnership and affiliation with a globally known health system. Another one is of our key strategic initiatives is transformation, because healthcare is changing all the time. Technology is evolving extraordinarily rapidly. The ability to keep up with those changes increases in difficulty year over year just because of how rapidly everything is changing. So this partnership would bring a digitally modernized an artificial intelligence enabled platform on top of that digital modernization, all connected to our historical great quality and a top 10 health systems quality, to ensure that it's implemented in the most effective, validated way, safest way, but a way that most enhances that clinical quality and safety for our patients in our community moving forward. So a lot of really great things coming together, but none of those affiliations and partnerships change the control of the governing board. So decisions will continue to be made locally by residents of this community so that they can ensure that the interests of this community are maintained in perpetuity. And that's really where things stand right now through the diligence. There are probably opportunities that might change over the course of that diligence period, but right now it appears that it wouldn't require that change in control that happens with most mergers.
Stay tuned next week as we discuss how this partnership is structured to protect donor intent and ensure that donor funds remain here in South County.